There's one last brief question I'd like to ask, and then we'll proceed with the closing statement. But after listening to all the testimony today, one thing has been clear, it was frankly clear before today's hearing, our outdated immigration laws are not working, period. But in addition to the other impacts of a broken immigration system, we attempted to focus today on how it's exacerbating the crisis that is our healthcare workforce shortage. So, Ms. Peterson, can you just comment briefly on how, if Congress does not act swiftly to remedy this outdated system, what are the implications for the health of Americans across the country?
Thank you, Chair Padilla. I'd like to go on record by saying I think we can do both. I think we can deal with our border crisis and deal with the urgent healthcare shortage crisis in the United States, because if we don't do both immediately, the numbers will continue to grow. At the beginning, we were talking about the 124,000 shortages of doctors over the next several years. It's only going to continue to grow. And what that translates into is Americans are going to continue to have longer wait times, have worse patient outcomes in terms of complications, more financial burdens. It will continue to compound. And it's not just the rural and the underserved anymore. It's all of us in the urban areas. It's your families and mine. Thank you.
Thank you. I actually think that's a great note to begin to conclude on, because we can do both, we must do both, but to utilize one situation, policy, issue, or challenge to keep us from making progress, bipartisan progress, on a clear crisis is unconscionable. I want to, before concluding, allow a number of statements that have been submitted into the record, and I'll read who they are from. We have received statements for the record from the American Association of International Healthcare Recruitment, the American College of Physicians, the American Hospital Association, American Medical Association, the Association of American Medical Colleges, the Cato Institute, the Educational Commission for Foreign Medical Graduates, the Healthcare Leadership Council, National Hospice and Palliative Care Organization, National Immigration Law Center, Southern Illinois Healthcare, Upwardly Global, and World Education Services. So without objection, these statements will be included, and the record will close 1 week from today. Now, as this hearing concludes, I want to thank our witnesses again for joining us today, as well as Chairman Durbin, Ranking Member Cornyn, and our fellow committee members. As I mentioned at the outset, today's hearing was not just about fixing our immigration system or about providing support to the healthcare workers who need it. It's about tackling the crisis of our healthcare workforce shortage. It's about saving lives. It was my hope today that in order to address an issue as important as saving American lives, that we could stand united to reform our system. That wasn't the spirit that all the members of the committee showed up with. So I want to make sure I make one thing clear before I close this hearing. The border has nothing, I repeat, nothing to do with the fact that we will need to hire up to 124,000 doctors by 2034 to fill current workforce gaps. We have a healthcare workforce shortage that is affecting millions of Americans. And there are productive solutions to address this. 2 bipartisan bills, which Ms. Peterson raised today, each of which have 25 bipartisan co-sponsors. And I'll note, I know he just left, and this is meant respectfully, Senator Cornyn is the lead on one of them. But instead of utilizing our time today to focus on meaningful change, we were met with repeatedly a misleading narrative. It's a frustrating pattern among many of my Republican colleagues. Now, I too was at the border just a few weeks ago. On the itinerary that day was a Border Patrol ride-along, in addition to visits to ports of entry and detention facilities. So let me be clear. our border is secure. Let me also be clear about this point. People presenting themselves at the border seeking asylum is a legal right that they have. But the reality is, it's the process that's broken, and it is in need of reform. But many of my Republican colleagues are only interested in fear-mongering. That's what I keep hearing. And if the only solution that they offer is to completely close the border, it's a non-starter. I was interested in hearing the ranking member speak today about working in good faith. We've been able to do so on a number of other issues. And he's right. We do need Republicans to work in good faith to help millions of Americans and to reform our immigration system. But working in good faith is acknowledging that we can do two things at once. Good faith is coming to the table to engage with experts and to respect and recognize data from our departments and agencies. Good faith is not showing up at a national workforce shortage hearing and focusing on statistics about gun violence in Chicago. Good faith is seeing a complex issue facing our healthcare workforce and coming together to find common ground that will save lives or to advance solutions when we've already found that common ground, solutions that enjoy bipartisan support, and not find excuses to not move those forward. But when Republican colleagues actually want to talk about solutions to improve our immigration system so that we uphold our nation's value and our economy, then absolutely, I am more than ready and willing to listen. And I can say the same for Chairman Durbin. Now that starts with being honest about cruel and misguided policies like Title 42 and MPP that are unlawful and have only created more bottlenecks and put more people in danger. As I said earlier in the hearing, we need to improve the legal migration pathways to undo the pressure on irregular migration. Legal migration pathways used to be a bipartisan issue, and they weren't conflated with border reform once upon a time. And we have bipartisan solutions just sitting here in front of us waiting to be passed. So it's a shame for this nation. It's a disservice, frankly, and especially those in underserved areas when it comes to healthcare, that Republicans won't let us move the needle forward, even on solutions they support. For the 95 million Americans living in an area with a shortage of healthcare professionals, including those living in Sheriff Martinez's county, we cannot afford to wait. It's not just health, it's lives that are at stake. Because every day that this workforce gap exists is another day that a loved one has to travel hundreds of miles for a doctor's appointment, or a friend has to wait too long for a life-saving preventative screening if they can get to a healthcare provider at all. What we've heard today leaves no doubt. We cannot address this shortage without reforming our immigration laws. There are thousands of highly qualified healthcare professionals already living in the United States who can join our healthcare workforce. As we heard from Dr. Allure, immigrant physicians are eager to serve the rural and underserved areas of our country that so desperately need care. And as Ms. Peterson pointed out, Congress can make reforms to allow more physicians to not just come to the United States, but remain in the United States after they complete their training. Congress can make more visas available for healthcare workers by recapturing unused visas in years past. And Congress can make exceptions to numerical caps to specifically address healthcare workforce shortages. For the sake of our nation's health, we must act swiftly to pass laws that will provide much-needed reforms to our broken immigration system and bring care to communities in need. So I want to thank again all of our witnesses for your participation here today, all my colleagues who attended and participated here today. And with that, This hearing is adjourned.